Welcome to the Dynamic Radiologist Podcast, where we feature leading experts in healthcare. And now, here's your host, Dr. Stephen Brownstein.
Dr. Brownstein here, host of the Dynamic Radiologist Podcast, where I feature top leaders in the health field and what they are doing to change the world. Past guests and organizations I've worked with include Rutgers, New Jersey Medical School, Newark Beth Israel Medical Center, National Pain Foundation, and many more. Today's episode is brought to you by Dynamic Medical Imaging that I started over 16 years ago. We are the leading experts in personal injury imaging. So you or if a loved one or someone that you know have been injured in a car accident, work-related injury, or had a slip and fall, give us a call. We have doctors all over New Jersey refer their patients to us. What is really telling, though, is these same doctors come to us for their own imaging and send their family to us. I've been a board-certified diagnostic radiologist for over 40 years, so I've seen almost everything under the sun. Go to www.dynamicmedicalimaging.com, and for questions, go to the Contact Us page. Our second sponsor today is brought to you by Spinal Kinetics, which I started with Dr. Kronk over 10 years ago. We help medical providers of all specialties evaluate for the presence, location, and severity of spinal ligament injuries. If you do stress radiographs of any kind, then you can send them to our trained doctors. You use our special technology. Spinal Kinetics has developed a technology called CRMA, or Computerized Radiographic Mensuration Analysis, which is an advanced X-ray measurement technology to accurately measure the exact abnormal motion problems that occur with the spinal ligament injury. If you have any questions, go to www.thespinalkinetics.com or email support@thespinalkinetics.com. Today, I have one of my great friends and a world-renowned leader, international leader, teacher, and pioneer in diagnosing spinal ligament injuries caused by spinal injuries that occur in motor vehicle accidents, sports injuries, and workplace. Jeff graduated from Palmer College in 1988, has a JD degree in personal injury law, was in private practice for over 17 years, has been the CEO of Spinal Kinetics, and for the last 10 years, and CEO of Biocybernetics for 12 years. He has published multiple articles in peer-reviewed journals. He's given hundreds, if not thousands, of lectures, webinars, podcasts, and personal consultations to doctors and attorneys throughout the country. He's developed the first online training program for doctors and attorneys dedicated specifically to spinal ligament injuries, called the Smart Injury Doctors and Smart Injury Lawyers program. Jeff, first of all, thank you for taking out the time from your busy schedule to be here with us today. Give us a brief backstory of how you ended up here today.
I ended up in ligament testing here today. Easy.
Correct.
I was a chiropractor for 17 years. The first couple of years of my private practice, I saw a lot of things that I didn't like, went out on my own, and starved to death. Spent 3 years figuring it out, getting my business together, and one of the things I realized after about 5 years of private practice was that I couldn't realign the spine. Spinal doctors of chiropractic are supposed to be able to realign the spine. You do adjustments, and the adjustments realign the spine, but the X-ray studies that I was doing at the time did not show that I was really realigning anything. At that point, I decided that I was mediocre at best as a chiropractor, even though I was making a lot of money doing it. And so I decided I was going to be one of the top 2% in the world that could actually align the spine. That's when I ran into a couple of different people. One was a guy named Harold McCoy, who was a DC, who was doing intersegmental motion studies. He was showing how much ligament damage there was with an injury patient. The first time I ever saw that was probably 95 or 96. I had the biggest aha moment for me, Steve, because for the first time in my career, I could tell how damaged a patient was in an injury case right away. Prior to that, there was no way for me to really determine how damaged there was. I could send out for an MRI if I thought there was a disc herniation, but I couldn't tell if there were other components that were damaged more significantly than just the disc. And so I couldn't tell the patient how badly they were damaged. And I realized very quickly no one could. And once I understood this testing procedure, I understood that anyone could. Now, I also went on to worked with a guy named Burl Pettibon, and I became one of the top chiropractors at being able to realign spines. I published some research on it and got very, very good at it. And the thing that constantly got me was that the ligament damage is what you can't misalign a spine. A spine cannot have misalignment problems without the ligaments being damaged. So, you know, when we look, any excessive misalignment or any excessive displacement of a spinal component that leads to neurological deficit, deformity, or pain is called a spinal instability, or it's called a spinal subluxation. If you're a chiropractor, it's called segmental somatic dysfunction. If you're a physical therapist, or you want to use that term. And so what I realized was that ligament testing was the most important thing that anyone could determine in a spinal injury. I set up my own company, worked for about 5 years in that company. Steve, you and I met, and I knew that I needed to merge that technology, my understanding of this, into a medical, that I could get broader implementation of spinal ligament testing if we would incorporate it into medicine. You were one of the forefront radiologists that I met that understood it. You were already into weight-bearing MRI. You were already into ligament testing. So this married in really, really well with what you were already doing. So we created a national company. And that company's design purpose, and the reason why I'm here today, and you've given me the ability to really put out as much information as I can, is because ligament injuries are the #1 cause of pain and disability. They can easily be diagnosed. They're not routinely being done today. And that's the whole purpose of Spinal Kinetics, of you and I bringing Spinal Kinetics out to the public, out to the professions.
Thanks. So for the lay people, define what is a ligament?
Well, ligament is anything that it's a connective tissue that holds joints together. So anywhere that you have a body joint, you have ligaments that hold it together. It's that tough connective tissue that holds it together.
And how many ligaments are there in the spine?
In the spine, there's over 220 specialized ligaments. 23 of those ligaments are discs. And, you know, it's a great point that you bring up, Steve, because there's been such an over-reliance on the disc as a ligament. The disc has 9 other ligaments around it. And so, you know, this idea, MRI is an amazing tool for disc studies, but it's not an amazing tool for the other thing that you pick up. It was never designed, you have weight bearing, so you have a little bit more of a design tool for it, but it was never really designed to pick up excessive motion. I can't lay down in an MRI and have somebody determine how much excessive motion I have, which is one of the primary findings of a ligament injury.
And so how are spinal ligament injuries assessed and diagnosed as to whether they're injured or not?
Well, here's the cool part. The cool part is we have, and I'm going to try not to make this too technical, but we have these terms in medicine called biomarkers. Biomarkers are any biological marker that's picked up in the body that leads to a definitive diagnosis. So HIV antibodies in the blood would be an HIV biomarker that leads to the definitive diagnosis of HIV. In imaging, we have a thing called imaging biomarkers. Easiest biomarker in imaging for anybody to think with is a fracture. You can't have a fracture without a fracture on imaging. Nobody can go, they can't palpate it. You can't determine how badly your leg is fractured without imaging, because we have to see the fracture in an imaging biomarker, and that's how we determine how bad the fracture is. When I said, look, any excessive misalignment of a spinal component leading to neurological deficit, pain, or deformity, we can identify the excessive misalignment of the component parts. The most problematic part is the ligament. Now, most people think of the spinal ligament as the disc or disc herniation. That MRI herniation on MRI is an imaging biomarker for a disc problem. We all know that, hey, if you do weight-bearing studies, it's far more accurate on what the problem is with the disc than if you're doing a lay-down recumbent MRI. But the other imaging biomarker that's picked up for ligament damage is excessive motion of the spine. That's most easily picked up on X-ray study. So simple, cost-effective X-ray study of the person bending and extending, and then accurate measurements of how much back and forth slippage there is or how much angulation problems there may be is the easiest way to determine the severity and location of a ligament injury. Without an excessive motion test and just an MRI, you are completely blind to how seriously damaged the patient is. Now, that, Steve, is reflected in the bad statistics that are out there. There's not a person on that would listen to this podcast that doesn't know somebody that suffers from chronic back pain, chronic neck pain. That chronic neck pain and chronic back pain was caused originally from an injury that was probably underdiagnosed. The person wasn't fully aware of just how damaged they were, and hence the procedures to correct that or to help rehabilitate it were not as good as they could be. So now the person has a chronic situation in their life that they have a difficult time getting rid of.
And you mentioned a little bit about the symptoms of if you have spinal instability. Can you go over them in a little more detail? If you have spinal instability, what kind of symptoms a patient may have?
Yes. Okay. That's a great question. So when you talk about the word diagnosis is a cool word. It says, hey, I'm going to look at the symptoms and then I'm going to relate them back to the most common physical reason why those symptoms would be there. So that's what we do in diagnosis. So the common expression clinically of a ligament situation, most common is low back pain. That's the second most common reason that anybody goes to a doctor in the first place is back pain. So if you have back pain out there, you're listening to this podcast, you have a ligament condition. It's just not been diagnosed. Or if it's been diagnosed, it may not be fully diagnosed. So note low back pain, very common. Neck pain. Matter of fact, low back pain is the leading physical cause of pain and disability in the world today. Neck pain, that's chronic, is the fourth leading cause. Headaches, really common cause from ligament damage, is the sixth leading cause. But let's talk about the other things now. Let's talk about, hey, if I got face pain, if I got ear pain, if I've got dizziness, if I've got cognitive function problems, if I've got pain radiating down my arm, if I've got heaviness or lack of sensation in my arm, if I have weakness in my arm, if I have pain going down my legs, pain radiating down my legs. These are very, very common symptoms of a spinal ligament injury. Those are the most common. We could get into ones that are a little bit less. I mean, people don't think when they're dizzy immediately, hey, I may have some problem in the upper cervical spine that's related to the nerves that would cause me to be dizzy.
One of our good friends, Doug Schmidt, an attorney in Minnesota, has, I don't know whether he's coined the term or found accelerated degeneration.
Yeah.
And what does that mean, and how does it relate to what we've already discussed?
It's such a simple concept. It means, look, you have these component parts of a spine, and if they're misaligned, they degenerate quickly. They wear out a lot quicker. So the easiest thing to think of is, hey, if my rear tire alignment was way off and it wobbled badly as I drove it, it's going to wear the tires out on that side very, very quickly, a lot more quickly than the other tires. That's all degeneration is. It's just it's a wearing down of the component part, but it's heavily related to poor alignment.
So what kind of questions should a patient ask their doctor or attorney in reference to what we've discussed about, the spinal ligament injuries, and make sure that they're going to the right doctor and represented by the right attorney?
Okay, great. So let's start with the doctor. So when you have a spinal injury, and one of the biggest things that I think the public should be aware of is most public choose an injury doctor, somebody to help them recover from their injury, with less scrutiny than they would choose an auto mechanic who's going to work on it. So if they have an auto mechanic that's going to work on their car, I mean, they are looking through the reviews, they're asking their friends, because they don't want to be ripped off, right? They don't want to have to pay more, and they don't want to get charged for things that they shouldn't have, be charged for or anything else. But people injure their spines, and when they injure their spines, there's a 50% chance that they will never, ever fully recover. But yet they're guided by, well, because some attorney told me to go to this doctor, this is where I should go, but they never review it for themselves. They don't do enough review and research to go, okay, if I'm injured, the thing I want to be looking for is somebody that can diagnose my condition, knows exactly what my condition is. So the questions I'm going to have for a doctor are, if I have a ligament injury, how do you diagnose it? If they're not telling you, I diagnose it with stress X-rays and MRI, chances are good they're not going to be a doctor that fully understands how to even diagnose how badly injured you are. If they just say, well, I just sent out for an MRI, you're getting a very limited picture. You have to use both. You have to use both. So the other thing that I'd be looking for in a doctor is, how good are your results? Right? If I'm going to go to a doctor and I have a chance that my neck is going to hurt me for the rest of my life, my back is going to cause me problems for the rest of my life, I want to get with a doctor that's really good at what they do. If I go in for a heart surgery, I don't want the average heart surgeon. I want the best heart surgeon I can find. If I go in for cataracts, doesn't matter. I want to find somebody who's really good at what they do. And if they're really good at what they'll do, they'll be able to tell you that they are very good at getting results. They're excellent at getting results. Their staff will be able to tell you, hey, we're really good at getting great results. Good. Great results doesn't mean that I'm going to spend a lot of time and at the end, I'm still going to have the same problem. So you got to question your doctors. With your attorneys, 98% from my own experience of attorneys in the market do not understand the injuries they represent. Now that's a problem because they think they're just soft tissue injuries. As a matter of fact, you may hear that from your attorney. This is classified as a soft tissue injury. There's only two tissues in the human body, hard and soft. Everything that's critical to being damaged that can cause you a lifetime of problems is soft, not hard. So soft tissue injuries are the worst injuries. They should be saying, oh, it's just a hard tissue injury, not just a soft tissue injury. So again, when you're dealing with an attorney, you want to deal with an attorney that understands the injuries that they represent. We have simple things that I've written about that anybody can contact our office, or even a patient can contact our office, and we could send you out information on how to better determine a doctor or determine an attorney to meet your needs so that you're getting what you need, which is great results.
Yes, you mentioned just this past week, an attorney that I have high respect for, or used to, we sent our white paper to, and he comes back with a response, this doesn't make sense to us. We don't deal with just soft tissue injuries. We only deal with traumatic brain injuries or fractures. And if he wasn't a friend, I would have wrote back, well, is a heart attack just a soft tissue? Is a brain infarct just a soft tissue? Is cancer just a soft tissue? This connotation that tries to minimize soft tissue injuries, which are really connective tissue injuries, and even a whole bone or hard tissue. If you look at definition, it means displacement of bone. If there's displacement, that means that there's aberrant motion. So that's again soft. It's the same thing.
Right. So break down what he said. What was his comment?
His comment was, this doesn't make sense to us. We don't deal with soft tissue, just soft tissue injuries. We deal with traumatic brain injuries and fracture cases, and we refer the other cases out.
Good. So this is what I'm talking about. Anybody that's listening, this is how confusing this environment is. There is no hard tissue in a brain. There's not one piece of hard tissue in the brain. Now, your hard tissue can influence it. If I crack my head and I drive the bone into my brain, that hard tissue can influence the brain injury, but the brain is soft. So when somebody says, well, we don't deal with soft tissue injuries, we only deal with brain injuries, it's like, it's kind of oxymoronic. Now, the other thing to think with is that when people have these traumatic injuries, oftentimes the thing that causes them not to be rehabilitated are the soft tissue spinal component injuries that are not allowing for the recovery of the nerve supply to go to these damaged areas. So to just say, really what the attorney's saying, and I understand what he's saying, hey, look, we want to deal with really high dollar cases. We don't want to deal with the $10, $15, $20,000 case. We want to deal with the $500,000, $2 million, $500, $5 million cases, and that's where they want to be. And that's fine. That's like a dentist that says, look, I don't want to fill cavities. I just want to do veneer work. I want, my common ticket price is $50,000. I don't want to deal with somebody that just wants me to do a $400 tooth drilling. So professionals can decide where they want to be in the market, and that's fine. But it doesn't reduce the need for those that are in a market that are going to take those heavy, severe traumatic injuries cases.
But even in those injuries, a large majority of those patients will have spinal ligament injury
100%.
diagnosed.
100%. 100%. But again, what I'm saying is the majority of attorneys, and I'm not saying that this is the case with the attorney that your friend that you were speaking of, but the majority of attorneys do not understand the injuries that they represent. So to make that more clear, if I had a seatbelt that caused a problem and in an accident, it released early, it didn't hold me, and I now have a brain injury as a fact that the seatbelt failed, I may take a product liability case. Could you imagine having the attorney who represents you on a belt buckle liability case not understand the belt buckle? I mean, it would be insane. Of course they would understand the belt buckle. I have a friend recently was in an accident last year. And when he was in an accident, he has a pacemaker, and the wire in his pacemaker broke. Right? That's not a common scenario that happens in an accident. It happened with him. Seatbelt, broke the wire. Now, when it broke the wire, they had to replace. When they replaced, he was on the table 3 times for about 36 hours because one of the surgeries caused a problem with clotting in his legs. Right? So he had an effect from the surgery. He had to have 2 surgeries to get this wire, to get this thing replaced. And that all resulted from a auto injury. Now, when he's working with an attorney, he has to have somebody that also understands heart conditions, the actual pacemaker, how the wires fit into the heart, how they could be damaged by the heart. So he's not going to walk into the guy that says, well, you know what? I do divorce work, I do criminal DUI, and I do a little PI work. I do a little personal injury work. You got to choose your lawyers carefully, and it's not always the ones that advertise the most that are the best. Sometimes they are the best, but it's not always that way.
Okay, so what do you see the future of Spinal Kinetics and where our company is going and how we can help more patients and help attorneys understand the situation, the problem, the burden of musculoskeletal injury that we're trying to solve?
Good. So really easy. The number one cause of chronic pain and disability today is a ligament injury to the spine. Employers can't afford them anymore. They're so expensive to employers, it's unreal. We haven't really talked about work comp. They're very expensive to the people who receive them in an auto accident. So those injuries right now are not standardly worked up. So if you go to 10 different chiropractic offices, you're going to get 10 different workups. If you went to 10 different medical facilities, you're going to get 10 different types of workups. That needs to change. The only way it changes is by understanding the injury itself. Once you understand the injury itself, there's not a person in the country that shouldn't be able to walk into a chiropractor's office or a medical office and go, hey, I have a spinal injury, and not get the exact same workup. Think about it this way, Steve. If you walk into a dental office and say, I have a cavity, you can walk into any dental office in the country and you're going to get the same procedures. That's what makes people have, in this country, much better teeth. So the first thing is there has to be standardized testing procedures. The only way you're ever going to standardize a testing procedure is if you do excessive motion testing up for the spinal injury, which is what Spinal Kinetics delivers. So Spinal Kinetics is on the forefront as a leader in the fact that it's a medical company that does excessive motion testing that allows the doctor to understand the level and the severity of the injury right away. There's not a patient in the country that has this type of injury that shouldn't have this test. Not one. Now, they're either going to get it from Spinal Kinetics or they're going to get it from somebody that delivers a service that replicates Spinal Kinetics. but they have to have the test. There's no way to know this information without being tested.
So what do you say to, I'm sorry, what do you say,
Go ahead.
what do you say to chiropractors that don't do X-ray, that treat the patients without doing X-ray?
Well, here's what I'd say to the patients. If you're injured and you're working with a doctor that has never done an X-ray on you, in my experience, that's borderline malpractice, because it's impossible for you to understand. It's impossible for me as a doctor to understand how damaged you are without imaging. I am 100%. I was in private practice for 17 years. And I'm really good, was very good at what I did. Without imaging, I can't tell how damaged you are. When I just said, look, excessive displacement of a spinal component that causes neurological deficit, deformity, or pain, I can't determine how badly deranged the spinal parts are without X-ray. So if they're flying without X-ray, you are 100% blind. And in some cases, you could be made worse. Because if I don't know how badly you're injured and I start to apply a treatment to you, if I don't know that you have a fractured hip in 6 places, and I start to apply physical therapy to you, and I start stretching your leg, I can cause that fracture to worsen. I can cause your situation to worsen. So, Steve, they're flying. My profession is very good at injury work, but it also is, there are some doctors in the profession that are not injury specialists. And you can tell a non-injury specialist because they won't use imaging.
I couldn't agree with you more. It's an oxymoron not to do X-ray. It's available.
Simple.
World. It's available to everybody that's been injured, and we could spend a whole podcast just discussing, the why of it. But we'll do that another time. But
well, the other thing too, Steve, and this is to show how much I mean this, what I say. If a person were damaged, they felt like they were damaged in an office, right? And there was no X-rays. It's very easy to do a post-event study and to see either what was caused or to see what was missed that could cause that. So if I'm sitting there there's no way I would work in a chiropractic office and work on a person. I'd have to be really confident of their past history of care. If they were coming in, they'd had care for years from chiropractors, it might be a different situation. But if they were new to me, there's no way I wouldn't image them. I would image every single patient. There's not a patient that I wouldn't want to know. If they have previous imaging, I'd order it. I don't have to re-image them. But you are absolutely 1,000% blind without imaging.
And also it sets the doctor up for being accused of something that may not have been true. If he did an X-ray and someone does an X-ray like you mentioned afterwards, or they have untoward effects after a treatment, he really has no leg to stand on without documenting early on what's wrong with their patient or his patient.
Totally. So you want to take a picture. Today, medical doctors are getting smart. Right? If you go in and you get a mole removed, or you go get a sty out of your eye, or you go where they're going to actually remove something from you, first thing they do, they take digital picture. Now, why are they taking a digital picture? So they can show exactly what the state of it was before they started to work on it. So it's like taking an X-ray. In that case, you don't need an X-ray, but you can't tell the state of something without an image. And you better be looking at the state of the spine before you're in there manipulating it and adjusting it. To me, it's ludicrous. And I think there are more problems in the market than what the market bears right now, because I think there's more problems being created from these procedures not being done. And people just don't know, oh, this should have been done. And therefore, the reason why I had a negative response was because the doctor didn't understand how badly damaged the person was.
Well, I think we've covered a large spectrum of spinal ligament injuries, and I think we've done a good job explaining the why, the how, and the what. And I truly appreciate the time today, Jeff. I know we have a couple more that we're going to schedule, but again, thank you, and keep up the good work.
Well, here's the thing, Steve, before we end, what I want to say to you is, look, I've been doing this now I've been really adamantly in the ligament injury area since 1995. And the thing that I really want to, thank you for is it's very rare to find a medical specialist that really digs deep and sort of wants to promote, wants to put a service there that can make a difference, wants to continue to educate, wants to continue to learn. So, thank you for being the doctor that you are, being the radiologist that you are, being concerned enough. This is not an easy business to put forth, right? So you as a radiologist, you have these procedures that you were taught, right? You weren't taught to look for excessive motion necessarily. You weren't taught to measure it, correct?
Correct.
Okay, so now you're expanding radiology. With your help and with what we're doing with Spinal Kinetics, this has a chance, and for the American public, this is the biggest thing that I would say today, this has a chance of being a standardized procedure. There's not a person in the world that has a spinal injury that shouldn't have an excessive motion readout done on them right away. And because of what you're doing and because of the pioneering efforts that you always have had, you've always been a pioneer in radiology, it's the pioneers that make things happen. And so, thank you.
Oh, you're welcome. And I guess we'd be remiss if we didn't tell the public about the article we published several years ago where we sent the 100 X-rays to a board-certified radiologist to evaluate for spinal instability. And we also did our trademarked CRMA, computerized radiographic mensuration analysis on those cases. Radiologists found no aberrant motion or ratable findings, and there was 27 ratable findings or severe sprain findings. Radiologists aren't trained to look for these things. They don't look for the things, and even if they did, without specialized software that we've developed, you couldn't diagnose these things. So, Jeff, with your help, we've moved this ball up the hill. We have plenty more movement to do, but we're both available to answer any questions that the public or doctors or lawyers may have. And we wish everybody to be safe and well in these times. And Jeff, best wishes to you and your family, and thanks again.
You're welcome. Thanks, Steve.
Thanks for tuning in to the Dynamic Radiologist Podcast. Make sure to click subscribe to get updates on our latest episodes.